darlings, I hope you're doing very well. Welcome to a new episode of Don't Hold Me Back, the first podcast created with and for people with learning disabilities. My name is Jules Bellis, and I will be your host. Today, we're going to talk about sexual and reproductive health. As usual, I'm not going to be alone, and today I will be co-hosted by an incredible expert by experience. So please welcome Carol. Hi. How are you doing today?
I'm okay.
Okay, good. And as always, Carol and I are not going to be discussing around like sexual and reproductive health on our own, but we have not one, but two incredible guests today. So please welcome Jeremy and Justine. Hello.
Hi.
Nice to meet you all.
Hi.
Shall I introduce myself?
Yeah, of course, go for it.
My name is Justine and I'm a specialist nurse working in Central Northwest London Sexual Health Service, and I run a specialist sexual health service and contraceptive service for people with learning disability in the borough of Barnet.
All right. And I'm Jeremy Woods. I work with Justine. My job title is the Learning Disabilities Coordinator for the Sexual Health Services in Camden and Islington, and we run the bridge service together. Yeah.
And who are you, Carol? Would you like to introduce yourself as well?
I'm Carol, and I live in Islington.
Fab, thank you very much.
What sort of sexual health do you do?
Okay. Shall I take that one?
Yeah.
Okay. So everything sexual health. When we talk about sexual health, we mean anything to do with your relationships, your body, your private parts, keeping yourself safe, testing for sexually transmitted infections, preventing those sexually transmitted infections, and preventing pregnancy. Getting pregnant, stopping having babies. And that sort of thing. So it's all of those things to do with anything to do with personal, private relationships, keeping yourself safe as well. So that's where we basically come from. Is safety. Yeah. And Justin, do you want to say a bit more about that?
No, absolutely the same. So it's about everybody that's involved is happy and that they're enjoying any sexual experience that they have, and that they don't have any regrets about any sexual feelings or any sexual activity that they might have. We just like to make sure that everybody involved is safe and that they're happy, and that there's no harm caused to anybody.
Mm-hmm.
Is there any difference between sexual health and reproductive health? Because sometimes in media we hear both terms. Is there any difference, or are they actually kind of the same thing?
They're all very much linked together. So we kind of say sexual health is all encompassing. It's making sure that your reproductive health is included in your sexual health, because if we are being sexually active, we need to make sure that we're not at risk of sexually transmitted infections, but also unwanted pregnancy if we don't want to get pregnant.
Mm-hmm. So very often we use the terms together. Sexual and reproductive health is the jargon that we would use sexual reproductive health, because obviously people do have sex, and not for but for reproducing, for making babies and starting families. So a lot of people have sex just for pleasure, which is what we're all about as well. So that's probably the difference, I suppose. Sexual health without the reproductive bit would be maybe just preventing sexually transmitted infections and things like that.
What are STIs?
So STI stands for sexually transmitted infection. It used to be called maybe STDs. Some people might know them as STDs still, when they were called sexually transmitted diseases, but they're not all diseases. They're infections that we mostly can treat, So that's when you hear STI, that's what we mean. STD, STI, sexually transmitted infection. So we test for all of those in our clinics. We've got two clinics. One in Camden, one in Islington, and there's two in Barnet where Justine works. We also cover some young people's clinics in Haringey as well, so we could test for any sexually transmitted infection. So some of those you might have heard of, like chlamydia and gonorrhea. Those are ones probably the most common. You may also have heard of HIV/AIDS. That's a very common thing that we test for. We can treat most infections like chlamydia and gonorrhea. We can treat them really easily, but you need to find out if you have them, so that's why you come to see us. We can test for those and try, we talk about them. So we try and, so people don't worry about them. If you're thinking about it or worry about it, you come and get a checkup. If you think you might have one or something, just come and talk to us at the bridge service. Yeah.
Mhm.
Is that okay?
Yeah, of course,
Yeah.
definitely. Justine,
Just
yeah?
Justy.
I was just going to say as well, is just reminding everybody that you can come to the clinic,
Yeah.
even if you don't have symptoms of these infections, because we hear lots of times that people might get different symptoms. So for instance, with chlamydia or gonorrhea, you might get pain, you might get discharge. For women, they might get problematic. They might have issues with bleeding and things like that. But the best time to come is if you don't have any symptoms, just come and have a checkup just for peace of mind. So anybody who is having any kind of sexual activity, not necessarily just having penetrative sex, full sex, you can have lots of other kind of activity that you can come into contact with these infections. So it's always, always, always a good idea just to come and have a checkup. And having a checkup is really, really easy, to be honest. And we can talk you through the whole process.
Yeah, and I have to say that people in North London are super lucky because there's a specific service that supports people with learning disabilities and neurodivergent folks. And it's not like that everywhere in the UK, but I'm pretty sure there's plenty of clinics that can support people that are part of the LD and more broad neurodivergent community pretty much everywhere, even if they're not specialized. So anyone, regardless of being part of the LD neurodivergent community that are sexually active, should get tested regularly. So we talked about testing, and testing is important for treating. What about prevention? Like, how does prevention look like for a person with a learning disability, for example?
Okay, so it's the same for everyone. I think our old friend, the condom, I think, is because it does, it stops most sexually transmitted infections, and it also will prevent pregnancy, unwanted or unplanned pregnancy, if they're used properly. So we do this still a lot. Condoms have been around a long time, and there's nothing better, nothing that does both of those things. I think just being aware, I think, of safer sex. And what that means. We don't say we use that term safer sex because we are human. We do make mistakes and things. So that's why we exist, where we've got big clinics. Because these things happen. But just knowing about what infections to look out, what signs to look out for. But condoms, and there are lots of new other ways. I mean, there's a new thing called a tablet called PrEP, which is a wonderful new drug that we've got people take, which prevents HIV. I mean, it's a massive step forward for us. But it only stops HIV. But that it's a wonderful thing. So people can take a pill every day, and that really almost cuts down to zero their risk of getting HIV. So that's something we could talk about in more detail. So
Question about that.
Yeah.
PrEP something that only people that part of the LGBTQ plus community need to take, or everyone?
Definitely.
Yes, and now originally it was just for LGBTQ population, but now we offer it to everybody who feels that they might be at risk of HIV, and we can usually have conversations and advise people if they need to take it or not. And like Jeremy said, it's really easy. It's one tablet a day. It's really easy to take, and it's a fantastic thing. That we've got available now for everybody. But we can do for condoms, we can do condom demonstrations because they can be quite difficult to get, to get used to using them. So we can kind of do education and training around using condoms. We also talk about using lubricants as well when we talk about using condoms, because condoms can split, like Jeremy said. So we hand out free condoms and free lubricant to anybody who wants them. And what the lubricant will actually do, will actually try and prevent that condom from breaking. So there's a less risk of catching an infection or getting pregnant if you don't want to.
So PrEP is really for anyone that feels that they have a risk, for HIV. We don't discriminate at all these days, because it's all funded now. It was a struggle to get it funded, but it is fully funded now by NHS England. So
Yay. One thing that comes up to my mind is another bit that you briefly mentioned earlier, which is support during pregnancy / and or the end of pregnancy. So in here we have Carol. Carol, you're a mum. So
Yeah.
do you want to share, you don't have to do it necessarily, only if you want, but do you want to share what's been your experience as a person with learning disability going through pregnancy? Like, did you get the right kind of support during your pregnancy from your medical professionals? Did you understand everything?
Not at first,
Okay.
because I felt pregnant very young. I felt pregnant when I was 18. Then I got when my mum told the LDP, and that's when I got the extra support.
You and your mum asked ILDP, which is the Islington Learning Disability Partnership Board, to support you, and then you finally got support during your pregnancy, correct?
Yeah, then with my support, then I got the same support worker what I had through my first pregnancy.
Mm-hmm.
Then she got contact in with someone called Special People,
Mm-hmm.
helped me to become a parent. Yeah, I wouldn't do anything without her.
Oh, that's great. But what you just shared with us, it's such a big lesson for everyone, because, you know, sometimes people might get pregnant and they don't know who to ask for help, you know, and knowing that, of course, in Islington we have ILDP, but everywhere in the UK there are local authorities that work with people with learning disabilities. So if you find yourself pregnant, you just need to get in touch with them and ask them for extra support. Justine?
Yeah, I was going to agree. We don't support people during pregnancy. So we are our job is to prevent pregnancy if people don't want to get pregnant. If people can see and they do get pregnant, we can then support them if they need it. From the bridge service perspective, we can support them getting involved with their local maternity service, who should have a named midwife that would be a LD lead in maternity.
We can support as well and give information or what we call signposting if they want a service for a terminate, if they want to end the pregnancy, you know, as well. So we can give information on that, and we can talk to people, you know, if they're really scared or worried, you know.
I don't agree to that.
You don't agree? Yeah,
That's perfect.
most people don't. That's what I mean. Yeah, but some people do. You know, that's the only option for them. But a lot of people don't feel it's there for them for whatever reason. Can be the family reasons, religious reasons, cultural reasons, anything. But you know, but it is available and it is free for people on the NHS. You know, that's important for people to know that that option is there for them. You know, and we can help them access that. You know.
Let's move forward
Yeah.
to another topic, which I think is very important when we talk about like health in general for people with learning disabilities, which is reasonable adjustments.
Yeah.
Okay. So what does reasonable adjustments look like when going to a sexual health clinic as a person with a learning disability?
First of all, we can, you know, sometimes it could be just a familiarization visit. We can organize a visit to come and, you know, maybe desensitize if you're feeling worried or, you know, stressing about what the clinic looks like, the process. That's available. We have a quiet waiting area here at the Archway Centre. We do, not all our clinics do, but luckily we do have a quieter area for people to sit, where there's no radio on or television, or it's always quite quiet. We can offer double appointments for people. We can offer appointments at a proper, you know, different times of the day that suits the patient, you know, early or late. We can try and get a familiar clinician. Say if they've seen one doctor, we'll try to get them to see that same doctor maybe. Yeah, any kind of, and any accessible information that they need, how they get the results, that can, you know, like an adjustment. So normally we get those texted, but some people would maybe want those printed out, or want a phone call, or need a, you know, or they need a letter or something. You know, so those are the main ones that we offer. You know, Justine, can you think of any more that we generally?
Yeah, we also as well, we can discuss with families and care support workers regards appointments, so we can all work together as a team to make sure that the patient is able to attend, that they have support getting to the service as well, because it can be quite difficult finding areas. I know our clinic in Edgware, lots of people get lost trying to find the clinic. So I give very detailed instructions, and I actually have gone out to the street to meet them and brought them into the hospital, you know. And I know with us in my clinic in the Borough of Barnet, I try and see my patients myself because I'm a specialist nurse. So I generally, for 90% of the things that we do within the service, I can actually see the patient and I do my own follow-ups. So they get used to seeing me all the time. And we involve, as I said, we involve family carers and support staff. If they feel uncomfortable, because we do tend to see patients on their own, because we do ask some personal questions that they might not want to open and discuss in front of other people. But if they feel that they do want to have support staff with them during that appointment, we are very, very happy for that to happen.
Yeah. Just to reiterate that, so meet and greet can be a really important part of it. So if people are, you know, the actual coming into a clinic bit can be the scary bit, or, you know, the worrying bit. So yeah, we always offer a meet and greet, or, you know, whatever, and how to get to the clinic. We can send pre-information. Sometimes we can send, if they need maps or that kind of thing, you know, anything about how to get to the clinic, you know.
And also everything that we provide in our service, so all our STIs, all our contraception, even down to having a blood test, we have patient information leaflets that are all in easy read format. So it's much easier for people to understand.
And this is the message for everyone, not just North London, but everywhere in the UK, that if you need to attend or want to attend a sexual health clinic, you can ask for these reasonable adjustments, and they should be able to provide them. Of course, sometimes it's difficult when you go to places that are not specialized to get everything that you need. But, you know, if you don't ask, you don't get. Let's put it this way.
And the trouble is, unfortunately, nowadays, everything is online. So booking appointments, all of our services are all bookable online. And so to get to speak to a human being on the phone to ask for those reasonable adjustments, even in your GP surgery, it's really, really difficult to actually get to speak to a human being. So that's why we're really proud of this service that we have. So we are a one-stop shop, you know, that it's a direct contact. It's a single point of contact to us. So people can we've got mobile phones, we've got emails, they can WhatsApp, they can phone us, they can send a text message, however kind of communication that they want to do. We're quite happily to do that.
Let's say, for example, that some people have some sensory issues. Let's say, for example, taking a smear test or using specific tools such as a speculum. How do you help your patients desensitize?
Yep.
Is that how we say it?
I can answer that question because I do a lot of examinations, and with my especially female clients, I offer them multiple appointments, so that it's a very slow introduction to the whole process. First appointment is usually just a conversation about what will happen, showing the equipment. They can touch and feel the equipment themselves, and then gradually, as time goes on, it might just be a case of the next appointment might be just getting them on the couch and making them feel comfortable lying on the couch. So it can take, from me myself, it can take as many appointments as my client needs. It's not just a case of booking an appointment, getting the smear test done, and if you can't get it done, see you later. It is, I take it very, very slow. I've got one client that I'm working with that it's been nearly 2 years I've been working with her to try and attempt to get her smear test, and it's very much on her time scale. Whenever she feels comfortable, we can take it a next step, the next step, the next step. It's never a rushed experience with our service.
Thank you, Justine.
That's the good thing about having our one point of contact. You know, we can have a conversation even over WhatsApp, just to ask before they come for their appointment, is that what do you need? And ideally they'll tell us. You know, they'll say I might need to wear my headphones in when I'm having. I might faint if I see blood. You know, and then we can give a heads up to the clinician, and we can just be in the room even just for the initial to hand that over and make sure that these things happen. You know. For patients. I mean, I'm just thinking of an example of what happened recently. That patient, she said she always faints when she has blood taken, but because we explained that she might need to wear headphones and look away, she was fine. She didn't faint for the first time ever. She was absolutely so delighted that she didn't faint having blood taken. You know, So that was just that for me. That was a big thing. You know, that we were able to offer that. You know.
And I was also going to say that a lot of the time coming to our service, it doesn't involve getting on the couch and having an examination. It's a much more straightforward process. So for men, it would be peeing in a pot. And for women, it is a tiny cotton bud swab that you can actually do yourself in the toilet. So it is a lot easier than it used to be. So it wouldn't be every time you have to get on the couch and have an examination. Unfortunately, sometimes when women in general, it's not the nicest of appointments for any of us. So it can be, there can be a lot of anxiety around having the whole process of having a smear test, especially having it done, including getting the results as well, is also quite a worry. And so that's why I try and do see my patients in my service and doing it in the slow process and giving them that time to get used to it, to prevent them having to go into hospital and be under a general anaesthetic, which is also quite a traumatic experience in itself as well. That's quite a scary experience too, from a health perspective and also from a anxiety perspective.
Yeah. Going towards the end, if someone's in North London and needs to go to a sexual health clinic, for example, the Bridge service, how should they reach out to you?
Okay, so for me, I cover Camden and Islington, so we have two large clinics. One large clinic in Camden down on the Tottenham Court Road called the Mortimer Market Centre. Where I'm based here at the Archway Centre is a really large clinic. We've got loads of space, loads of room here. So I usually encourage people to come here. It's quite accessible from both Camden and Islington, and we're right opposite the tube here, Archway Tube, and there's all the buses come up the Holloway Road, and we've got buses come up from Camden up through Kentish Town and Tufnell Park that way. So we have one phone number for the Camden and Islington, and Justine has one number for Barnet. So it's on we have a flyer, we have an easy read booklet. So I'm hopefully you're maybe going to give people the number at the end of this, so that if people can text, they can WhatsApp on that, or they can phone on that. There's also
I'll put all information in the description of the video, so people just need to click.
And we also have an email that will get to both of us. So if someone prefers that method of contact, we have a Bridge service email. So there's pretty much, and that's, as I say, that's for everyone, for family carers, referrers, support workers, and for patients. We really promote self-advocacy here for people with learning disabilities to make their own choices around their sexual health and reproductive needs. So so that's what our game is, really, just to promote that.
The other thing I wanted to say as well, because we haven't touched on it, is we also do a lot of work around relationships and sex education. We can do that in one-to-ones. We can do that in our service, or we can go to day centres, meet people in the community and provide that relationship and sex education. We also do group work as well, so we can see larger groups. And we try and make it really fun. It's not a very serious lesson. We try to make it as fun as possible. So if anybody was ever interested, please do reach out as well.
Yes.
We can absolutely provide relationships and sex education as well.
We tend to do those together. We do those together as a little double act.
I'm pretty sure that we are gonna have the chance to talk about relationships with you from the Bridge service again, because spoiler, we're gonna have an episode on safer dating for early next year.
Cool.
What about people that are not in North London? Who should they reach out to?
Well, we can offer advice. We can offer advice, but just if people can travel to our services, we can offer the service. So basically, we are commissioned and funded to work in our own boroughs, like Camden, Islington, and Barnet. So if people can come into our boroughs and come to our clinics, that's because all sexual health is open access, where you don't have to stay in your borough. You can go to any sexual health clinic and get the same service, and it's all free. But for the Bridge service and for the specialist support that we offer, it's you need to come to us, or we can offer over the phone, by text, or virtually. We can support, if we can. But that's the way it works.
if traveling to London is not an option,
Okay.
back to the Elfrida Society, so you can visit our website www.elfrida.com, or you can follow us on Instagram at the Elfrida Society, and you can send us an email at enquiry@elfrida.com, and I will try to do my best to signpost you to the right service for you in your area. Okay, so is there anything else that you would like to cover for today?
No, I think if that's it, really. That's covered. Just we've done our promotion of our service. Just to remind people that it is a free NHS service. I'm not sure we said that clear at the beginning.
Yeah.
So we are. It's an NHS service, and everything we do is free. And free. It doesn't cost any money. Yeah. For anybody.
Carol, is there anything that you would like to ask?
No, that's perfect.
Yeah.
Amazing. So
Cat there on your lap, I can see.
yeah, there's an amazing
my cat.
Ears.
the emotional support cat.
Yeah.
Mine outside. Anyways, I really want to thank Jeremy and Justin for coming to this episode of Don't Hold Me Back and explaining everything that we needed to know about the breech service and sexual and reproductive health. And so hopefully now you know a little bit more, and maybe we've also given other services a few ideas of how to make reasonable adjustments for people with disabilities. Maybe it's a learning experience for everyone.
Okay, I hope so. You're welcome.
Thank you very much. And thank you, Carol, for being an incredible expert by experience.
Thank you.
And this was another episode of Don't Hold Me Back, the first podcast created with and for people with learning disabilities. And I'll see you in the next episode next month. Bye.